So here you see case of huge salphingopharyngeal fold hypertrophy. You can see that the eustachian tube on the right and the left side, that's the eustachian tube on the left. The adenoids are very little, not too much. At the end of the adenoid, you can see the throat pack. The adenoids are not much. The salphingopharyngeal folds are, uh, the tubal tonsils are really huge. I'm going to reduce the salphingopharyngeal folds at a setting of 9 for ablation and 4 for coagulation. And actually speaking, the lymphoid tissue is not really very big. Here the folds itself are very large. Obviously, I cannot create a lot of space, and I need to make sure that I do not create a problem of nasopharyngeal stenosis either. So I am removing the adenoids. I am reducing the bulk of the salphingopharyngeal folds by ablating the lymphoid tissue on the top of it. But I do not want to create a nasopharyngeal stenosis. So in the lower part here, at this point, I will not do anything on either side, so that there is no circumferential raw area created. I will definitely remove the adenoids. It's not a very regular anatomy, it's a little different anatomy. I'll remove the adenoids completely, and I'll reduce the lymphoid tissues from the salpingopharyngeal folds also, but only in the upper aspect, not in the lower aspect. Because superiorly there is a lot of space, there's a small vessel which I coagulated. I'm going into the depth of the adenoid. And we'll remove the adenoids completely, obviously. We'll not leave behind adenoids because that's the best way to create a lot of space. But at the same time, I will not create a circumferential raw area in the lower part, because that's where stenosis can happen. Going layer by layer, I have removed the whole adenoid. I cannot see the fossa of Rosenmuller so well in this case, which is in this area. I'll be very careful going laterally. There's still a little bit of adenoid tissues pending, which I'm still removing. going layer by layer so that I do not dig anywhere deep inside. That's the fossa frozen molar. Being very careful not to damage anything laterally. That's the superior boundary now reached completely. That's the periosteum below the sphenoid bone, now completely cleared. So I was going layer by layer because I wanted to be very careful. Here also, you can see layer by layer, I am actually going deeper and deeper. What was seen on the scan, CT scan, the adenoids are really enlarged, but because of the abnormal anatomy of the salphingopharyngeal fold, it was not appreciated so well. So in such cases, always go slow, go layer by layer, never be in a hurry to dig. Now you can see the buccopharyngeal fascia here very clearly. You can see the buccopharyngeal fascia very clearly now. That's the posterior boundary. And still a layer of adenoid tissue which I need to remove. This is the adenoid tissue. Obviously, that needs to go away. Adenoid tissue. So, adult adenoids are always a different ball game. She is 33-year-old. Now, you see how large the salpingopharyngeal folds are. I'll be really careful in the lower part. I'll be really careful because see, as I can you just release this? I'm releasing the soft palate catheter. Let me release the soft palate and try to show you. And I'm releasing the mouth gag as well. Now see how it's almost coming and touching each other. So I'll be very careful about creating a raw area on each side so that it does not create a nasopharyngeal stenosis. Can you pull it again? So I'll only go in the uppermost part. I've created a raw area here. I'll not create too much of a raw area on this side. I'll only coagulate the lymphoid tissue or maybe even ablate the lymphoid tissues here where the tissues are pretty far away from each other. So this is a very large salpingopharyngeal fold but not too much of lymphoid tissue as I expected. So here I'll be very careful not to create a circumferential raw area so that it can give a nasopharyngeal stenosis. I have already removed the adenoid, but I'll leave this much of mucosa behind. I can come in front, but I'll leave some mucosa for it to regenerate. And I'll not take a chance of a circumferential raw area creation so that it can create a nasopharyngeal stenosis. So this is how we have to balance ourselves. This is a raw area already created, so I'll coagulate the lymphoid tissues completely here. If you leave some raw area, some mucosa in between, then that will act as a barrier to circumferential raw area creation and a nasopharyngeal stenosis. So, back of the right salphingopharyngeal fold, let me just clean this scope. I'm coagulating this area so that whatever area is laterally is actually coagulated and it does not create a impedance in the airway. So you see, this is our grace. This will not let the whole area circumference, contract circumferentially. Thank you for watching.